Fracture of neck of the femur. Fracture of neck of the femur is common in old age due to senile osteoporosis. It is more common in females. There are two types, intracapsular and extracapsular fracture. Intracapsular fracture refers to fracture of neck of the femur, and extracapsular fracture refers to the intertrochanteric fracture. Classification, three classification: anatomical classification, PAUWEL'S classification, and Gardner's classification. Anatomical classification. There is subcapital, transcervical, and basal. Here, this is subcapital, this is transcervical, and this is basal. We must remember that the more proximal the fracture, the more worse is the prognosis. PAUWEL'S classification. It is based on the angle between the fracture and the horizontal plane. These are type 1, type 2, and type 3. So type 1, it is the angle between the horizontal plane and the fracture line, which is about 30 degree. Type 2, the angle between the horizontal plane and the fracture line, this constitutes about 50 degree. And type 3, between the horizontal plane and the fracture line, this constitutes 70 degree. The more the angle, the more worse is the prognosis. Then Gardner's classification. We have stage 1, that is incomplete and impacted fracture. Stage 2, complete fracture and non-displaced. Stage 3, complete fracture and partially displaced. And stage 4, complete fracture and totally displaced. This Gardner's classification is mostly used nowadays. Clinical features. There is history of trauma, fall on flexed and rotated hip. There is pain which increases on movement. The patient cannot walk on the affected limb, and the affected limb is shortened, abducted, and externally rotated. Investigations we do is an X-ray pelvis of both hip, anterior and posterior view. Why both? For comparison purposes. Treatment. If the fracture is a fresh fracture, if undisplaced, then fixation by 3 cancellous screws. If displaced, and if the age is less than 65 years, fixation by cannulated hip screw. And if the age is more than 65 years, replacement hemiarthroplasty. Total hip replacement if the hip is arthritic. And if the fracture is 2 to 3 weeks old, if age is less than 65 years, fixation with McMurray's osteotomy or Mears operation. And if the age is more than 65 years, replacement hemiarthroplasty. What are the complications? The complications are non-union, avascular necrosis of the head, and shortening of the limb.